Hello, good evening.
Hi, good evening.
Hi, good evening.
How are you?
I'm good. How are you doing?
I'm fine. It's so you.
How was your day?
My day was busy. My day was good actually. Yeah.
Busy is good. I know for you, busy is very good.
We have a talk tomorrow. Our department's organizing a talk tomorrow. Tomorrow, Rovin's talk in the morning. So I
Oh,
was
that's
busy
wonderful.
with that. Yeah. Yeah.
That's wonderful.
So,
All right. So,
yeah. So,
good
do
evening.
we wait, yeah. Do we wait for some time to let everyone join in?
Yeah. I think people are gonna slowly join in
Okay, all
because
right.
I'll be saving the live. I think they can watch it
Oh, you
anytime they want.
can watch it later. Yeah, correct.
Yeah. So, good evening, everybody. We have Dr. Nicole with us. She's a very good friend and also my senior in my college. Yes.
Hi.
So, yeah, I want you to introduce about yourself.
Oh, okay. I thought you were going to do that.
You'll
No,
do
okay.
you'll do better.
So, I'm Nicole, everyone who's watching, and I have completed my MBBS and my MD in pharmacology from Pharmacologist Medical College, and presently I'm teaching. I'm an associate professor there at the Department of Pharmacology, and I also I'm a simulation educator there. So I am heading the pre and paraclinical. I'm basically the coordinator for pre and paraclinical sciences in Pharmacologist. Yeah.
Yeah.
So that's bit of, and I also love cooking. Other than that, I love cooking. I love traveling, and I think that's more exciting.
She's a professional cook or chef, and she's a professional traveler.
No, I'm just I'm learning. Yeah, we're all students, so yeah. So yeah, you can call.
Yeah. She's being modest, but she's very good at what she's doing. Besides that, so I want to tell you why I chose this topic. Um,
Yeah.
because I don't own a pharmaceutical company. Let me tell people that there is no conflict of interest. I'm not here to promote any drugs or any medications.
Yeah.
It, I, it, as a psychiatrist, it's my responsibility. As a doctor, it's my counseling. They should get the counseling. But I know a lot of patients, when I ask them, why didn't you come and see me if you're going through some symptoms of some disease for so long? They told me that they were scared of taking
Yeah.
medications, allopathic medications, especially psychiatric medications, because they have heard so much about them, and they have read so much about them on Google. So I don't want misinformation to be a roadblock for people's recovery. That's the reason why I thought
Yeah.
we should do this talk. And who better than you to do a talk about medications, because you're specialized in the
Okay.
field
Thank
of pharmacology, right? So I want you to tell people what are these drugs. When they say when they say you're going to a drug store, when you go to a medical shop, what are these medications? What are these allopathic medications?
Right. So when you're talking about medication, when you're talking about a drug, so what is a drug? A drug is nothing but a molecule or a substance that is that is given to treat an individual, to treat a particular disease in an individual, or to diagnose a disease in an individual, or to prevent it. Say, for example, now we have a COVID vaccine that's going to be released. It's helping in preventing, producing antibodies to prevent an individual get the disease, getting a disease. So this is what a drug is, and there are various kinds of drugs that are available. There are some that are that are sourced from plants, some that are sourced from animals, some that are synthetically produced inside factories. So these pharmaceutical industries, they make these drugs. They're synthetic or they're semi-synthetic in nature, but the molecule, the molecule where they get the idea from is basically from a plant or a herb or something like that. Now those kind of medications which are only herbal, they're all alternative kind of medications. Whereas, you know, the ones that are synthesized or which are semi-synthetic in nature, they are, you know, classically termed as allopathic medication. You know, allopathic medication. So, in a nutshell, this is what a drug means. You know, this is what a drug means. It's used to treat a disease, or it's used to prevent a disease, or it's used to diagnose a disease process in an individual. And, you know, so a drug can actually can help an individual get out of that disease process. So it can help, you know, treat an individual who has a pathology, or it can also help who has, you know, an individual who is, say, for example, even who is having a normal function, also can improve and elevate, you know, those normal functionalities in a human being. So that is what a drug is. I hope I answered your question.
Yeah. That's very clear. Now, actually, in fact, I was seeing a patient 1 hour back, and came with multiple polysubstance, was taking cannabis and smoking and alcohol. When I told him that, you know, I'm gonna give you medications that will help you get off these addictions, he told me, "Oh, it's ironical that you're giving me drugs to get me off drugs, right?" So, but then I explained him that these are drugs of abuse. These are not drugs of therapy or treatment. If
Right.
you have to, like, very generally tell, how are the drugs of abuse different from the medication that doctors, what do you think?
Right. So, you know, when individuals come to you for a particular, condition, you know, like, say, for example, you're a psychiatrist, you treat individuals who have anxiety, you treat individuals who have depression, you know, bipolar mood disorder, etc., etc. Now, these individuals also have some associated, substance abuse, and they end up, you know, utilizing, say, alcohol, or they end up utilizing cannabis, as you said, or, uh, it's very often that these people these patients who come, who will say, oh, you're giving me something else which is equally bad, like, is this this is what you do. So what we need to do is we need to explain to them there's a stark difference between these two things.
Yes,
There's a
yes.
stark difference. There's a stark difference. You know, the kind of drugs that individuals abuse, they have, long-lasting effects on the human body. It can be in the brain, it can be in the liver, it can be many organs. You know, many organs. Say, for example, alcohol can affect the liver. You know, alcohol can affect the liver. It can reduce the amount of how the drug is getting broken down. You know, so we need to clearly identify and inform, and rather educate the patients that come today about the difference between what substance abuse is, and what drugs we are utilizing to help improve your condition. Because sometimes certain drugs, allopathic medications as people call it, or here in particular psychiatric medications, they used to improve or elevate a person's mental condition if the individual has a mental health issue.
Yeah,
At the end.
yeah, that's true. Also, I think, before getting into psychiatric medications, I just want people to understand, when you take a medication, what happens? What does it do in the body? First of all, what are the different routes that we take medications?
So, as everyone consumes drugs, often orally. Oral is one method where we can give drugs. You can also give drugs intravenously. You can give drugs intramuscular. You can give it, by a patch. A transdermal patch can be just applied to the arm, or to the mastoid process, or to various parts on our body. So that's some of the routes. You can give a route, you can give a drug rectally. You can give a drug, subcutaneously. Things like that. Drugs can be instilled directly into the brain, the ventricles, various other organ systems. So these are a couple of routes how you can give drugs.
Yeah, and the commonest obviously being the oral.
The commonest is oral, because there are so many advantages of giving a drug orally. There's so much of patient compliance. The individual just has to take the medication on their own. It's easy to do. It's easy to do. You just have to tell take it in the morning, after food, before food, etc., etc. So individuals patients can understand. It's easy to do. There's compliance, and people don't forget to take their medications and things like that. So this is a clear advantage. You don't need asepsis. Like, say for example, you're giving a drug via IV or IM. You don't need to, like, say for example, produce put alcohol swab and make sure that you're in the right place and position.
Right.
So you don't need a trained individual to do it. You can do it yourself. Easy. So this patient,
Yeah,
So
but
this
with some big. Yeah, please go ahead. Please go ahead.
I was saying, go ahead.
Because I work in my hospital is in the IT area. A lot of engineers and a lot of working population comes to me, and they tell me that when they ask me, the medication, how long does it take for me to get better? I'll say depends on the condition, depends on your diagnosis, depends on that. We'll get to that. But it'll take, few days. It's not going to be instant. Then they ask me, why don't you give me a IV medication that works quick? Right?
Okay.
I mean, yeah. So generally, what are the advantages of intravenous route over?
Okay. That's a good question. So when you decide to give a drug via intravenous route of administration, that means the individual is having a very acute illness. It needs attention immediately. It's an emergency. You have to give this drug via intravenous because it enters into the system very quickly. It enters into the blood. It enters into the systemic circulation almost immediately. Like, as I'm snapping my fingers, when I push the drug, it enters into the systemic circulation. Whereas when you give a drug orally, it will take some time. And why does it take time? Because it has to cross so many barriers. It has to go through your esophagus. It has to enter your stomach. It has to break down. So it has to, there is some amount of dissolution time that takes place. Then it has to be absorbed by the gastric arteries. Then it enters into the systemic circulation. So it takes, and especially for psychiatric medications, it will take quite a long time because it has to reach the central nervous system. It has to reach your brain, right? So that is why for certain conditions, say for example, if the individual has acute psychosis, yes, you'd want to give a drug via intravenous route of administration. So it depends on the condition. It depends on how serious the condition is. If the condition is an emergency situation that warrants a drug to enter into the systemic circulation, enter into the blood very rapidly, attain high concentrations, then the route of administration should be IV. But otherwise, oral is preferable. Is very much. If the individual finds it difficult and says, I don't even want to take the medication orally, or if the individual is not compliant in taking his medication, then you can give the drug via IM, like a depot preparation or something like that. That will act, for probably months together, and you don't have to worry about patient taking it or not.
Right. Yeah, talking about depot preparations, some patients ask me that the previous doctor gave them an injection once in a fortnight or once in a month. But why are you giving me medications every single day, 2 times a day? I tell them that not every medication is available in depot form. There are only some of them that are available in formulations. Yes.
So when pharmaceutical companies, when they make these products, it goes through a rigorous process of trials. There's so much of permutations and combinations that they try, and they see whether this product is viable, whether it can sustain, whether you can give it depot, whether you can give it IM, whether you give it IV. Certain products don't come out. Certain products are wonderful orally. Certain products are wonderful IV. Certain products are wonderful when you give it into your muscle. So so that's why it's so important. To all our listeners here, your doctor is the best person to guide you. He's the best person. Your psychiatrist or your therapist is the best person to guide you and tell you, this route of administration is suited for you. So take it. So listen to your psychiatrist, listen to your therapist, listen to your whole team of doctors who are behind you in case if you have a mental health issue.
Right.
Yeah. Also, to all my like, if you guys are there, I would like to also, Charan, introduce yourself and, tell me a little about what kind of patients do you treat on a daily basis? Like, what kind of patients come to you, and what is your experience in the past, number of years that you've been working as a psychiatrist?
Um, so I've been working as a psychiatrist for almost 8 years. 3 years was my post graduation where I was seeing patients, and then last 5 years I've been practicing. Um, I think my experience has been great. My only difficulty, only difficulty in psychiatry is not stigma to see a doctor, but stigma to take medication. People see me.
Okay.
It's not a big deal. People see me because they, maybe they think that I'm approachable or I'm young, so I understand them better. A lot of patients see me, but the moment I say, okay, you know what, I see a lot of symptoms of anxiety. I want your heart is at risk if I don't treat you. I'm going to put you on medications immediately. Oh, no, 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 doctor, I don't want medications. I want you to talk to me.
Okay.
Yeah, so my
Yeah.
major roadblock for treating patients is the stigma around medications. Thanks to clumsy representation of these medications and my whole branch in movies and media. That's a real clumsy representation, I should say, where they, like you take a medication and suddenly you have seizures, or you walk like a zombie and things like that.
We
Also
will,
in movies they show,
yeah,
like if they want to get your property, they will start giving you psychiatric medication, so you lose memory, all that nonsense. So that's the reason why I feel people have strong, yeah. So that's my
you're
only
absolutely
roadblock.
right. Yeah, there's so much of misrepresentation in movies and in the media today. You're absolutely right. Just the other day, I was watching a movie called Side Effect. I don't know if you've heard of it,
Which one?
but it was
Which movie?
Side.
What?
The movie is called Side Effect. It was on Netflix,
Side
I
effect.
think. I
I saw
can't
the
remember.
movie. Yes, yes. I saw the movie.
Yeah,
Yes, yes.
right. Yeah, that was a very interesting movie, a nice take. But yeah, but as you said, there's a lot of misrepresentation about psychiatric medication and their their adverse effect. As in broad terminology.
Mm.
So, as you said, people just go up and, say for example, you prescribe. I'm sure you must have had a lot of patients come to you and say, oh doctor, this drug has this side effect. I'm not going to take it.
Yeah,
Right?
yeah, yeah, yeah,
Right? Yeah.
yeah,
So,
yeah.
yeah, absolutely. So, everybody just, it's very common these days. We don't use our brain for anything and everything. We will go on Google. We will go to Google and we'll be like, okay, this particular drug, and then we see a barrage of side effects. Very commonly done today. And immediately the patient will be like, doctor, I don't want to take this medication. Why? Because it has this side effect. They don't understand, Charan, that they are not helping themselves by doing this.
Yeah, yeah.
They're really not helping themselves. In fact, we are having a pandemic here, but they don't realize that there is such a big infodemic. There's a massive infodemic that is taking place in everyone's lives these days. Like this, yeah, no, really. So there's so much of information out there, and everybody thinks that, everyone's a hypochondriac at the end of the day. They look at something and they're like, oh God, I have it. Right?
Yeah, yeah,
So,
true, true.
yeah, so that's the thing, So what we need to realize is that there are side effects with anything and everything that you take, right? Even if you eat your breakfast cereal 10 times a
Yeah,
day, you end up having diabetes, or you'll end up, getting bigger and things like that. But listen to your doctor. The advice that we want all of our listeners today is, listen to your doctor. He's the best person to identify and tell you that this kind of psychiatric medication has this kind of effects, this kind of side effects, at the end of the day. What is your experience, Charan, with the use of, say, for example, anti-anxiety medications and the side effects observed with it? What is your experience with the use of antidepressants and the side effects that are observed with it? Can you just highlight?
yeah. So I deal with different kinds of patients, different patients from different walks of field in terms of education, socioeconomic status, and just their attitude towards allopathic treatment itself. So the problem here is, initially I had a very honest and transparent approach with all my patients, where, because I did prepare for my American exams also before, so I read about ethics and how you have to tell patients that these are the side effects and everything. And in India, like, we don't really follow that. Like, we don't tell patients they're the side effects. So I thought, let me follow American method because I thought that is definitely far more superior. It didn't work well for me because when I tell the patients that, before they ask me, I should tell them, so this is the medication, this is what it does to your body, which is fantastic, but sometimes it goes to unwanted areas. It binds in unwanted organs and tissues. So you might experience, the might is obviously,
Yes,
yeah,
very
the
good.
might is obviously
Yeah,
0.1% or 0.0001%, that less of side effects. Then they get curious and they're like, what are these side effects? Then I tell them that whatever, you might feel a little nauseous or you might feel like you're going to vomit, because that's the first commonest side effects that we read as medical students, like nausea, vomiting, diarrhea,
yeah.
right?
In fact,
You might
no,
experience.
no, it's so simple. A side effect
Yeah.
is nothing but an extension of the action of the drug. It is just
Yes.
an extension of the action of the drug. So, say for example, an individual is, prescribed. Say for example, an individual is prescribed an anti-anxiety medication for his anxiety. So it calms the person down. So when it calms the person down, it kind of changes the neurotransmitters that are produced in the brain. So and it depresses the central nervous system. So the first thing that you will see is the person feels drowsy. So it's basically an extension of the action of the drug.
Yes.
So some individuals, some patients, they're very patient, they're very understanding, they are, very open to these things, and such individuals, they respond better to treatment versus individuals who are always, they are, constantly at a war with what your doctor is saying, what your therapist is saying, and what Google is saying.
And what your
Right?
friends are saying, what your friends
What
and
your
family are saying.
Correct. Absolutely. You're absolutely right.
So when I was explaining patients about the side effects,
Yeah.
some of them were obviously scared that, oh my God, these are the side effects. When I tell them that I'm telling you all this, so you know that if you experience any of this, I'm just a call away, or you can come and see me in the hospital. But
Good. Yeah.
good chances that you won't, that you will never. And some
Okay.
patients, because I mentioned them about side effects, they never started treatment and they came back to me 6 months later, 1 year later with severe symptoms, or they were referred from, yes, they were referred from cardiology unit or, ER or different places like that. Or I saw them in ICU. For example, let's just say I saw this patient who came with clinical depression that required and sleep disturbances that required medical help. And I told her that I'm giving you something for sleep, I'm giving you something for depression. Patient
Right.
obviously thought sleep medication, which we're going to talk about later. Sleep medication, I don't want, I'll get addicted to it. I'm like, no, you won't. It'll take years for addiction. Even if you get addicted, I can get you off the medication in a progressive, like in a good way. Don't worry about it. She never took medications. I saw her 3 months later with suicidal attempt in the ICU, admitted in ICU.
Right.
I mean,
Right.
compared to not getting treated, you chose not getting treated than getting treated and having a very bleak chance of having a side effect. So that I
Right.
don't like. I can't wrap my head around it.
Yeah. So in a nutshell, they are worried about not about the disease process, but they are so afraid, and they're so afraid about falling akin to the side effect. But what we need to highlight is they're a part and parcel of a drug. They are seen, they are observed, but not in all individuals.
Yes.
They are seen,
Yes.
observed, but not in all individuals. And so, my dear followers and listeners, what you need to know is, you know, uh, a psychiatrist has so much amount of information and so many years of experience. They are the best people to identify and decide whether this medication is doing any good for you, right? They are the best people to decide that. So you should not go ahead and say, oh, because the medication is causing this side effects, which I saw on Google, I'm going to stop the medication. Or speak to your doctor. Speak to your doctor about the side effects. Be very open to him. Talk to him about the side effects and side effect symptomatology. Discuss about his experience with the drug and the side effect, and so you'll have a general idea, because you are the best you're the best person that an individual can come to and discuss because of the years of experience. you have. Side effects are seen in almost all drugs, but what we need to identify and keep in mind is, um, ad, under adverse effects, you have side effects, which is, very more a modest kind of an effect. Whereas on the other spectrum, you have these
Severe.
reactions of severe reactions that can also take place. Now, that is something that is very important. So these severe adverse reactions are something that you need to inform your doctor. Like, say, for example, if you get a rash, or if you have swelling of the tongue, or you're swelling of your lips, or itching, scratching of, itching of your tongue, or swelling of your throat. All these things are important. So that is when you need to, like, call your doctor and tell him, you don't need to worry that much about the side effects, but at the same time, communication is so important with your doctor, about how you're feeling, what kind of side effect profile you're having. If he's calling you the next week, go ahead and go and meet him, discuss about it. And he's the best person to decide when you're doing well. Because, see, most of the medication, they, say, for example, antidepressants, how long does it take for the action to be seen?
It will take, if you look at the textbook, it says 4 to 6 weeks. But then I see improvement in patients from the week 1 itself. But for clinically significant improvement, it takes about like a month or month and a half. Yes.
Exactly. So it will actually take few months for the drug, for you to see, clinically in an individual feeling better. So once the individual feels better, the individual thinks, in 2 months, I'm feeling all right. I feel great. I don't need to continue the medication. I can stop it. I don't need to go and see my doctor. I'm feeling totally fine. But no, we how long does it take for antidepressants? How long do you advocate the use of antidepressants if the individual has, say, for example, mild, moderate, depressive.
Right. Mild. Usually, like I don't start medications. I send them for therapy, or I tell them some lifestyle modifications, because depression is a lifestyle disease at the end of the day. It's not an infection. It's not a cancer.
Yeah. What is lifestyle medication? I mean, lifestyle modification. Sorry.
Lifestyle modification is obviously first thing is, it depends. If they're in a high stressful environment, I tell them to get out of the job and get a new job. Solutions, basically problem resolution, right? Because even though if I'm giving you medications, but if you continue to live or in the same abusive marriage or in a terrible job, you will continue to get stressed. And not just depression, you can have hypertension, you can have cardiac failure, you can have multiple diseases. So I tell them, just get out of that particular area and get another job for 1 or 2 months, live on your savings, which is completely fine. These kind of tips I tell them. And if they want elaborate therapy, I send them for therapy as well in mild cases. If there is a stressor, if there is no identifiable stressor, I obviously try to rule out if there are any vitamin deficiencies or thyroid abnormality, or there are multiple conditions for depression that I rule out.
Yeah.
Yes. And I treat them accordingly. But otherwise, in case of severe, they'll be somewhere around 1 to 2 years of medications. For moderate, let's just say 3 months to 9 months. 3 months to 9 months.
Yes.
It's not lifelong.
Yes, that's what we want to highlight. So at least it will take 6 to 9 months for an individual to get better. So don't get off your medication once you feel better. Your doctor is the best person to identify that and tell you, and you should never stop any medication abruptly, right? None of these medications need to be stopped.
No.
Stop.
So about this stopping abruptly, what I wanted to tell you is, how many patients I lost to follow-ups because they're doing well. They're doing well and they lost to medications. They come back in 1 year. I see at least, at least 80% of them come back. Maybe other 20, maybe they went to another doctor. I don't know. They come back and saying that, doctor, I'm sorry, I stopped medications, and now for last 1 year I'm fine. And now again they came in bigger intensity.
Right. Yes, absolutely. They have a different set of issues to deal with. So that's what we need to identify. Medication, they take at least a few months, at least 6 to 9 months to act. And once you feel better, don't think that you can just stop the medication, but discuss with your therapist, discuss with your psychiatrist, because he or she will be the best person to identify if you need to get off your medication or not. And he or she will do it for you. They will taper the medication off slowly, and then once you feel better, then they can pull off the medication. But you should never do it on your own. You should never pull off the medication on your own. So that is what we need to highlight. Yeah.
I mean, this is not just for patients. Unfortunately, what I experience very rarely, but I did experience this problem of. Are you able to hear me?
Yeah, I'm able to hear you now. It's in comments.
Okay. Yeah. Unfortunately, what I saw is, some patients go to like RMPs, or maybe like an MBBS doctor, or maybe doctor of other specialties, a physician or somebody. When they go to them and they tell that, I'm on this particular medication, they come and apparently they were told that, oh my God, why are you using these medications? They're dangerous. Why don't you just do yoga or meditation, or why don't you just feel better? Why are you taking psychiatric medication? Doctors, some of the doctors, ignorant doctors, told this without having expertise in the area. So that is what which I didn't like at all, because patient can have misinformation because they didn't specialize in the area, and they're not even like a MBBS doctor. So it's okay. I mean, I'm here to clear their doubt. But other doctors who doesn't know, they couldn't like interfere into the other's job. But this is very rarely that happen. Not every doctor does this. Most of the doctors tell that I'm not specialized in it. I'm sure Dr. Charan is. Go back to him and ask him your queries. Find out if there are any interactions between my medications and his medications. To my knowledge, there are no interactions, but you can ask him. Now I want to ask you, what are these interactions? What are these interactions, and why is it important for patients to tell their psychiatrist or any doctor that I am on other medications as well, not just these?
Yeah. So what we need to realize is, when we're using multiple medication, we can say, for example, in relation to psychiatry, when we use psychiatric medication, and say, for example, we have another disease process that is also taking place. Say, for example, a very common disease or hypertension, or any other, lifestyle disease that warrants medication. Am I Yeah. So when we take multiple medications for diseases that an individual has, there's a high chance for these drugs to interact with each other and either reduce the effect, and the psychiatric medications, or reduce the effect of, say, for example, the hypertensive medications or the diabetic medications that the individual is on. So what's going to happen is one disease process is going to suffer. One disease is definitely going to suffer. So it's either your mental illness that is going to suffer, or your lifestyle disease that is, that you have is going to suffer. That means, you may end up having something worse, okay, or you may end up having a side effect that, or an adverse effect. So that is very important.
Yeah.
They don't interact, they don't produce, sheet their effects, and give rise to even more side effects, or reduce, or increase the disease process, and things like that. So that's very important. You have to discuss about the kind of medication you're taking with all the doctors that you visit. It's very important. They'll be able to highlight all these things to you. There are things that Google can't teach you, but your doctors know so much because of number of years of experience. So that is very, very important, and important to speak to your doctors. I think there's
Nicole,
a network,
you're actually
connect.
Yeah, there's a network problem. Is it from your side or from my side? Because I have full network.
Yeah.
I mean, do you have a network issue there? I'm not able to hear you actually. I'm not able to hear. Can someone text in the? Yeah, I can. I can't hear you. Can you hear me? Can you hear me? You can't hear me. Oh, okay, that's not good. Um, can you end your live and maybe join me again? And end the live and join again. Yes. So if people have questions they can ask, and now I think we have little time left, and we're going to discuss about special populations. For example, children, old people, pregnant women, and breastfeeding, lactating mothers. So what are the drug related things that people should be aware of? And before that, when Dr. Nicole was telling, communication is very important. It's like absolutely true. From patient side, there should be absolute communication. But if your doctor is not communicating well to you, that is again poor communication. So you can either request your doctor to that you want to be you want to know more about the medications, or you can change your doctor. It's as simple as it. You can always go for second opinion. There is nothing wrong with it. It's your body and it's your health. So yeah, that is one way for you to probably find a doctor who communicates better. Hi, welcome back.
Yeah, thank you. I
You are
think there was
still,
some network connectivity.
yes, yeah. Thank
Yeah,
God you're back. Yeah.
nice to see all of
Um,
you guys.
yeah. So now, before we go to any other topics, I want to quickly discuss about special populations, starting with,
Okay.
starting with pregnant women. So, what is the whole deal with? Not deal. Deal is the not right word. What is the whole issue with pregnant women in their trimesters and taking allopathic medications? Now, forget about psychiatric. Allopathic medications. What is the problem here?
Right. So, what we need to keep in mind is, when when a lady, when a woman is pregnant, there is, there are a lot of, there's a lot of added, responsibilities. There's a hormonal imbalance. Yeah. The person may be working, the person may be at home, they could a lot of things. So, in addition to that, what we need to also understand from a very, kind of a, a change that occurs that the mother eats, drinks, and even breathes. So, so when a mother consumes an allopathic medication, right? That again, these allopathic medications, especially when it's used in special populations like in pregnancy, they are again categorized. Okay, they're categorized. I'll not go into the details, but I'll just say A, B, C, D, and X. Okay, X means they are not supposed to be used during pregnancy at all because there is some amount of known damage that occurs, right? Whereas certain drugs are extremely safe, can be used in pregnancy. Category A, they are called. So, say for example, the mother has a fever. Okay, so forget fever. There is an increased nutritional demand of certain drugs, of certain molecules during pregnancy, like iron. Iron is required, so that's why we supplement with iron. Folic acid is, required for the baby, for the baby's growth. Calcium is required. So that's the reason why we need to supplement calcium, iron, folic acid. All these drugs are safe. If the mother has, say for example, paracetamol, she has a sprain, she can take aceclofenac, she can take diclofenac. So there are certain category of drugs that are safe, that are deemed to be safe in pregnant women. And as you move in the category, like in B, C, D, and X, it is shown to, data, there is evidence, scientific data that is, there out there that shows that it is not safe for the fetus. So it's very, very important to speak to your doctor about what kind of medications you are taking, and if you have any illness, what kind of medication, can you take these medications or not? It's very important. You just can't go to the a pharmacy and say that oh, I need this, I'm not feeling all right, I want to take this, I want to take that. You can't do that. You have to speak to your treating doctor, speak to your OBGYN, they'll be the best people to give you advice about the use of certain drugs when you're pregnant.
Yeah. So the same issue. I mean, a lot of my patients plan their pregnancy around me stopping medication. So they ask me, doctor, when I plan to stop medication, when I tell them maybe by September, they'll be like, okay, I'll conceive in the month of October. I tell them, I don't think so. You need to do, that kind of care, because these medications are safer in pregnancy. Some medications are definitely not. I don't deny that, but you're not on any of those medications, and there is no way that these would damage your fetus. So I tell patients, but they're like, oh no, but someone told me that psychiatric medications in pregnancy are very dangerous. I tell them, any unnecessary medication in pregnancy is dangerous.
There are a class of agents that we avoid giving in pregnant women, because there is evidence that is shown that there is some damage to this. So that's the reason we don't prescribe. Whereas there are some that are to be very safe, and they can be used. Because at the end of the day, the mental health of the mother is important. The mental health of the mother is equally important as the growth of the fetus. Both are equally important. If you're not mentally sound, how will you carry on the pregnancy?
Yeah, I mean,
how
there is more research. There is more research about if you're not mentally happy or mentally doing well, and if you bear through the pregnancy, the likelihood of baby having cardiac abnormalities and adrenal tumors and things are much likely to be higher than the ones that did not. So even if the medication is causing side effect, that's still, you can't even compare the difference. I mean, there's a huge margin. So I tell patients, might as well get treated and give rise to a healthy baby than not and depriving yourself of medical care and giving rise to a baby in a stressful environment. It's very, very, very important. Yes, but sometimes like when sorry. Yeah.
No, you were saying, go ahead.
Yeah. But sometimes, maybe let's just say I put you on a medication. Let's just say you have bipolar. I put you on a mood stabilizer. And now you become pregnant and you come and tell me the doctor, I became pregnant. Then I know some of the medications are not safer to you, to your fetus, not to you, to your fetus. So what I do, I will switch the medication to a safer medication. But what patients do here is that they will stop medications abruptly and they will not come to a doctor. Then they'll have another episode of either mania or depression closer to their delivery time, and that becomes a huge mess that you can't reverse.
Absolutely. Yes. And I can't stress on the fact again and again. See, if you are on, a mental health disorder and you plan your pregnancy, discuss that with your doctor. It's so important.
Yeah.
Or, see, because even if you don't have a mental health disorder and you're getting pregnant, pregnancy itself, changes, there's a hormonal imbalance in your central nervous system. Forget, the progesterone that is released or by, your corpus luteum. But, so there's a constant hormonal imbalance that is seen in pregnancy itself. So that's why it's so important to to highlight to your psychiatrist or to your OBGYN, to discuss about these things openly. because individuals who have mental health disorders and who can get pregnant, and who get pregnant can continue taking medication to treat their illnesses, so that both the mother is happy and the child is also healthy, at the end of the day.
Yeah, yeah. Fortunately, I work with a hospital. We have wonderful OBGYN team, so they take my advice in almost every pregnant woman, and they send every patient for counseling, because first time primary gravidas, the first time pregnant women are very anxious, any which ways about their pregnancy. Also, with the advanced maternal age, there's even more higher risk for genetic counseling and prenatal counseling and things like that. So, I mean, touch wood, I had no problem, but I heard horror stories from my other patients, other friends who are doctors, that told me that, oh, like pregnant women just go missing from medications, and they come back around the time of delivery. It becomes a mess that, even we can't help. Sometimes, pregnancy gets terminated because of X amount of stress that they put on them. So I tell patients that come to doctor. Nobody's going to forcefully put medications in your throat.
Yes.
We can discuss treatment options and we can take it forward from there.
Absolutely.
Yeah.
Very well said.
Now about lactating women, right? I mean, when you're breastfeeding, because I know some of my patients, they breastfeed for 5 years and 6 years also, because the baby wouldn't just stop. So mother heart goes out to them, and they just keep feeding, and they won't come to psychiatrists for the depression till they're feeding, because they know that the drugs can enter the baby through the milk, through the secretion. So what's the whole deal with this lactating?
Yeah, so again, a special population, lactating mothers. So what we need to identify is, there are certain the drugs that individuals consume, right? They enter into various spaces in our body, and one of these spaces is the breast. And especially for mothers who have just delivered and are feeding their infants, there is a high likelihood of certain. So there is a nature of these drugs. There are some drugs that are attracted to water molecules, and some that are not attracted to water molecules. So they are hydrophobic or they are hydrophilic. They are lipophilic or they're lipophobic. So these drugs, they bind to certain, say for example, the milk, and they are again, the milk is nothing but a bodily fluid. So it has to be it gets excreted out. In the sense, it is actually food for the child here. So it can enter. There are some psychiatric medications that even cross, this barrier and enter into the breast milk, and eventually what happens, these effects are seen on the fetus. So that's why it's very important, again, your doctor is the best person to identify what drugs are released into the breast milk and are for your child. They are the you. So please don't think that, oh, all psychiatric medications, can't be taken during pregnancy. Once you deliver the baby and you're lactating also, you cannot take it. No, you can. There are some drugs not enter into the breast milk and are deemed to be very safe and can be given.
Yeah.
There's nothing to worry about. And again, your doctor is going to give you that specific, but it is that particular dose given how many times a day. That is, that's also very important. At the end of the day, the drug gets metabolized. We need to remember, it gets broken down. It gets broken down in the liver. It gets broken down in your gut. It gets broken down in, your various parts of your body. So you need to remember that that particular dose sometimes will not be treated in the breast milk, but a higher dose can be excreted in the breast milk. So that's why it's so important to discuss with your psychiatrist, or discuss with your therapist or your treating doctor about, doctor, I'm going to lactate. What about, will it affect my child? Ask these questions. Be open with them. Create that dialogue, so your doctor becomes like your best friend, not someone that you don't like going to.
Yeah.
In fact, it should be always a give and take. You should develop this relationship with them. Yeah.
I mean, I know some medical students are going to watch this live as well. For them, if you become a psychiatrist ever, it's equally our job to even find out if they're lactating. For example, any lady that walks into, of reproductive age group that walks into my OPD, obviously I have an icebreaker, right? I'll ask them, hey, what's your name? Where are you coming from? And how old are you? What do you do? Are you married? Do you have children? When they say, yes, I have a child, I ask them, how old is the child? Then they'll say 2 years.
Yeah.
Are you feeding the child? It's not my place to ask
Yeah.
that. It is not my patient biodata that are you feeding the child, but I
Yeah.
ask them. So I know
But it's
I'm
an
going to
important
think
question.
about other medications. I'm going to completely cut off
Correct.
on some medications. And even these medications, understand that your doctor is even more careful than you as a person, because we read so much and we are more paranoid and apprehensive about like medications more than you. So what I do is,
You have years of experience. I mean,
yeah,
that is something that, many don't have.
yeah. So
So it's true.
I mean, I have a lot of lactating mothers that are taking medications and are doing wonderful. There is no problem at all. I clearly tell them that, hey, listen, it'll take about 4 to 6 hours to enter your. I'm giving an example of one drug. This is not for all the medications, by the way. Let's just say this medication enters your breast milk in 4 to 6 hours after you take. Till that 4 to 6 hours, you can breastfeed the baby because the drug hasn't entered the breast milk. But after that, because it is
Absolutely. So
in your body secretions for a period of 6 hours to 8 hours, that time avoid feeding. Or you can express your milk and you can feed that, or you can give supplementary feeding to the baby. After that 8 hours
yes,
has passed off, you can feed the baby by discarding just a little bit of milk in the beginning. There is no way on earth the drug can still enter the baby's body. So yes, even doctors, it's our responsibility to explain the patients. Even if you have a busy OPD, it doesn't matter. If you're busy OPD, don't give too many
yeah,
appointments. Like don't bite more than you can chew. Do justice to your patients. Give them maybe not. It's not too much of time. At
yeah.
least enough time to understand. The important queries are solved at least in one visit. All right. I think our live is going to end in 8 minutes. So I want to ask you a question for the last 5 minutes. So quickly, I will tell patients about two populations, right? Talking about children and old people. For everybody understand, old people, any doctor, the first treatment mantra that we all follow is start low and go slow. We are not going to be aggressive in
Absolutely.
controlling the symptoms of any illness. I'm not talking about psychiatric. I'm talking about physical, neurological, whatever it is, gynecological, any symptom. We're always going to give medications according to your age, according to your gender, according to your body mass index, according to what are the other diseases you have, what are the other drugs you're taking, according to your habits. Are you a smoker? Are you drinking
Yeah.
alcohol? Multiple things like that. So don't worry about old people, why to give these medications. We always start low and go slow. And children is again the same way. FDA approved a few medications are very safe in children. Those medications we give, and they're definitely safer than other medications. So you don't have to worry about that. Your doctor will definitely help you with all these queries. Not Google. Don't come to doctor for prescription and don't go to Google for clarification of prescription. That is not your second
Yeah,
opinion.
that's
That is actually a burial
yeah,
ground. Don't do that.
yeah. No, absolutely.
Yeah. So Nicole, this question I want to ask you is for a lot of medical students, because I also work in a medical school. A lot of my medical students follow my page. So there is this whole thing about taking only clinical branch for specialization. Pre and paraclinicals
Okay.
are usually, I'm not saying always, usually not people's first choice. You took, I know you wanted to take ophthalmology, and then fate had another plan for you and you took pharmacology. It's great. I mean, you're doing
Right.
fantastic in your field, and you say that this is an arranged marriage that is working well for you. So tell people, what is MD pharmacology? Like, what do you guys do? What is the scope for you? Like in a quick 3 minutes, because it ends by itself. Yeah.
Yeah. So once you complete, MD in pharmacology, there are many choices. You can either work in a medical college, right? Or you have opportunities. There you can branch out. Say, for example, now you can work. You can become a simulation educator. I'm doing. You can branch out by teaching simulation in pharmacology. You can even go up to uh, You can go into adverse drug reporting, and you can get into. So these are a couple of areas where you can branch out to. You know.
I'm sorry. I think your voice. Nicole, I think your
Yeah,
voice
I
is
think
breaking.
that, yeah.
Yeah. Yeah. So for me to understand, you said
Yeah.
medical college. You can work in adverse drug reporting.
You can work
What
in
did you say?
company. Yeah.
Pharmacovigilance. You can work in pharmaceutical companies. You can obviously work in research area of drug trials.
Identifying adverse drug, that are observed in a large population, like the whole, almost a select population. Say, for example, in Southeast Asian countries or India, or the whole world as a population, and you can identify these adverse drug events and you can report it. That itself is a major branch in pharmacology, and we have many people. In fact, we have many alumni from my department who are doing very well for themselves in pharmacology. We have a couple of really large companies that only do pharmacology. Someone talking tomorrow with us, Dr. Robin, he's doing really well in pharmacovigilance. So that's another place that you can go. Or you can see a media advisor. You can go into just general clinical trials. You can get into research. You can there are many areas that you can you can end up working after you complete your MD in pharmacology. So don't feel like pre and paraclinical subjects are a dead end, but in fact there are so many opportunities. Like, I never knew I would take up simulation. Now today, simulation has come up and it is a part of the medical curriculum. Today, without simulation, colleges are not moving forward. So it has become a part and parcel. Simulation, labs have become a part and parcel. So, you can create these things for yourself if you're very interested. You can create these, these opportunities. There are many opportunities that are available. It's all about the mindset that you have. That's extremely important.
Yes. Yeah, I mean, it's all about mindset, and also it's about you not following a herd mentality. It's you choosing your own path. And I'll tell you something, you do whatever it is. If you're good at it, everything will follow you. Money will follow you, success will follow you, everything will follow you. And more than all of this, you're going to be a happy doctor, that, you're doing something, something worthy. That is very, very important.
Yes, you have.
Yeah.
When you pick up a field like medicine, you need to mind that you're going to be a lifelong learner. It's not like you finish MBBS or you finish in pharmacology and then done. I'm going to relax and that's it. Get married, have a couple of kids, and bye bye. No, it doesn't work like that. We should push us. We should be so inquisitive. That's what I always tell my students. Be like a sponge, absorb everything that's good, and excrete all the things that don't want it. But everything is important. Even that negative things or those bad experiences that you had is also equally important, because it shapes you as an individual. So never feel that, if I picked up anesthesia and I don't like this, I wanted psychiatry and I didn't get this. Don't worry. Don't worry. You can create a niche, kind of a clientele for yourself, or you can excel in something that, identify the gray areas. Identify the gray areas and make it black and white. And, be good at it, learn and, work hard. That's another thing that we, stop doing. We stop working hard. We think, fame is going to come. But, we need to work hard. We need to have a plan in mind. In fact, sometimes we need to have a plan A, a plan B also.
I have plan C, D, and D also.
Oh, that's excellent. That's excellent. Now you're smart. Now that's what's being smart. So you need to have many plans, yes. So because, you never know. Life is so unpredictable. Whoever imagined a pandemic like this, causing a pause button in all our lives, creating so much of, like this. You don't know what's there tomorrow. You're just living for today.
Yeah.
So,
True.
But yeah.
Sorry, I think the live is going to end in 10 seconds.
I know.
I really want to thank you. Thank you so much, Nicole.
Thank you so much for having me.
I hope I hope everybody would get benefited by this. And good night, guys.